this. We are just getting our first video from the very first interview with nurse Nina Pham. She's the first nurse to be infected with the Ebola virus after taking care of the patient who died of it. During the interview, she describes the scene after the hospital received Ebola patient Thomas Duncan. It's hard to hear it, but there are words at the bottom of the screen so you can watch and listen. Look at this.
Thanks for getting well. Thanks for being part of the volunteer team to take care of our first patient. It means a lot. This is a huge effort by all of you guys. Yeah, we're really proud of you. All right. Party now. Okay. You need anything? Okay. There's no crying. Well, happy tears are okay. Otherwise, no tears. No crying. It's not loud. We love you, Nina.
Wow. Joining me now, Fox News medical correspondent Dr. Mark Siegel. How extraordinary. I mean, a couple things jumped out at me. Her tears, obviously she's overwhelmed. We talk about it antiseptically, but she's actually going through it, a life-threatening illness, and she contracted trying to help somebody. And then just how covered the healthcare worker was. I mean, it's got to make you feel so scared to see somebody having to wear that to take care of you.
Not a bit of skin was exposed, and that's one of the issues with the original treatment of Duncan, which was, you know, as it's coming out from Nurse Aguirre, that the people were walking in there with their neck uncovered. And when that happens, I think people out there need to realize that the sicker you are with Ebola, the more secretions you have. Mm-hmm. So with all of this talk we have about traveling on the plane, which is inexcusable, still, it's the sicker you are. And that's why healthcare workers get it. Because when you're in a room with a patient with Ebola that has vomit and diarrhea and blood, they have a lot of it in their blood.
Well, but here's the problem, too. Here's the other problem. Let's say that Nina Pham wore that suit right there. Let's say she did it perfectly, thanks to being informed by the guidelines and having them enforced. They're saying more and more now they think she may have gotten in the early stages, perhaps when it was undetected. When he came into the hospital, he was vomiting, he had diarrhea, and it wasn't diagnosed as Ebola yet. A nurse in that position wouldn't be hazmated up. So, I mean, the dangers are extreme.
And by the time, that's so true, Megyn, and by the time he came in, he was already quite sick.
So that's why people say there should be a travel ban, because the best solution is to keep people with Ebola out of the country.
Well, look, let me talk about that for a minute. I think the best solution is to try to solve this in Africa. We need a ton of resources going in there. But I think with the CDC having fumbled this much and the public health authorities in Texas this much, I mean, in West Africa, if you have a patient with Ebola, 2 other people get it on average. Well, guess what? That's what we have had here so far.
Right.
The greatest healthcare in the world, 1 patient gets it and 2 more get it.
Right.
I think the public, until they feel that they can have confidence in their leadership here, are going to be so afraid and so panicked that I think you're right. We may need a temporary ban.
Right. Best intentions aside, what matters is the result. Let's talk about the nurse you mentioned, who's a whistleblower from that Texas hospital, who came out and said, we never even talked about Ebola, never even talked about it, and that the health care for Mr. Duncan was a chaotic scene with mass confusion, that they were not adequately protected, that their skin was exposed. I mean, what's to stop this at this point, Doctor, from having this happen at another hospital? Are we now to believe the CDC is so on top of its game, we have nothing to worry about at these other facilities?
No, absolutely not. I've been to a lot of hospitals, and everybody's variable. I went into one, they said, oh, we don't have the right shield, use this one. I went into another one, we don't have the gloves, use this one. And even if you use all the right suiting, I tried putting one on this morning, when you take it off, you know, the Ebola is going to be everywhere unless you know exactly what you're doing. You know who has to do this? People that have experience taking care of Ebola. That's who has to do it. Mm-hmm. And with the fear quotient so high, imagine what it feels like to be a nurse or a doctor going into that room. You know, when you get nervous, that's when you make mistakes.
Right. And just seeing her there, 26 years old, in tears, you know, tears of joy, tears of fear, but seeing her so vulnerable in over something she caught just in the course of trying to save a man's life, and now her own is in jeopardy tonight. Last word.
That is the key thing, that she's a very caring individual, that she really got involved with it, and we should honor her for that and never, ever criticize this. This could happen to anybody trying to take care of a patient.
Look at her trying to maintain a positive attitude. God bless her. Doc, good to see you.
Good to see you.
See this. We are just getting our first video from the very first interview with nurse Nina Pham. She's the first nurse to be infected with the Ebola virus after taking care of the patient who died of it. During the interview, she describes the scene after the hospital received Ebola patient Thomas Duncan. It's hard to hear it, but there are words at the bottom of the screen so you can watch and listen. Look at this.
Thanks for getting well. Thanks for being part of the volunteer team to take care of our first patient. It means a lot. This is a huge effort by all of you guys. Yeah, we're really proud of you. All right. Party Maryland. Okay. You need anything? Okay. There's no crying. Well, happy tears are okay. Otherwise, no tears. No crying. It's not loud.